So good afternoon, everybody. Welcome to a lovely and sunny day in New York. It certainly wasn't like this last night, and I know some of you took some time to get here due to the bad storm. So my name is Nana Gore. I lead the Every Woman, Every Child Health Team in the Executive Office of the UN Secretary General. And I have the pleasure to facilitate this briefing event on a theme that is very important to all of us in this room today, meeting the multisectoral challenge of antimicrobial resistance. Thank you all for coming today. I'm very pleased to see such a diverse group gathered in this room this afternoon. And together with our co-organizers from the REACT Network, and the Dag Hammarskjold Foundation, I am grateful to the missions of Argentina, Korea, Mexico, the Netherlands, South Africa, Sweden, the UK, and Vietnam for their co-sponsorship of this important event. Before we get started, I wanted to let you know that you can follow the conversation about this topic on social media today with the hashtags AMR and EWC is me, Every Woman, Every Child is me. And you, on your tables today, you have a social media card with some suggested tweets and messages so that we can reach a wider and global audience from our conversation. I'm also pleased to let you know that the event is being live broadcast via Periscope on Twitter, via the Every Woman, Every Child handle, and the event is also being recorded and will be made available on the Every Woman, Every Child website following the event today. So, simply put, antimicrobial resistance is one of the most significant global challenges we face today. Every 5 minutes, a child dies in Southeast Asia from an infection caused by drug-resistant bacteria. HIV, TB, and malaria patients and progress on maternal and newborn health are already at the forefront of antimicrobial resistance in many countries. Indeed, the threat goes beyond just health as well. The spread of antimicrobial resistance could have a large impact on the global economy, which we will hear later from Lord O'Neill, and undermine the ambitious new Sustainable Development Agenda, which the world leaders came together to agree on last September. As the recent outbreak of Ebola in West Africa has shown, health crises can have a major impact on countries and even threaten peace and security. In short, we will not be able to fulfill our collective ambition of leaving no one behind in the 2030 agenda unless we are serious about reining in antimicrobial resistance. So, what can we do to stop this becoming a reality? We will need to galvanize action from across sectors and multi-stakeholders, from the public and private sectors, scientists, doctors, patients, and consumers themselves, as well as across the multilateral system. It is clear, AMR is not an issue that can be dealt with in isolation. We've made a good start through agreeing a global action plan at last year's World Health Assembly and similar resolutions by the FAO and OIE, and a call to action by the G7 leaders, particularly a couple of weeks ago in Japan. But more can be done, including by the UN in New York. The goal now is to accelerate the mobilization to raise AMR to the top of the political and global agenda. That is why the General Assembly has called for a high-level meeting this September. This is an important year for action on AMR, which we must seize now, and that is why we are here today. So let me first thank you all for coming to this discussion. I hope you'll find it both engaging and enlightening, and I look forward to working with you all on this important issue in the future. We will first hear from the permanent representative of Mexico to the United Nations, one of our co-hosts for the event today, Ambassador Juan José Gómez Camacho, who was unable to join us here today but has recorded a video message for this event. Ambassador Gómez was appointed by the President of the General Assembly to lead consultations to finalize the organizational arrangements, including a possible outcome for the UNGA high-level meeting in September. So I'd like to hear a video message.
Good afternoon to you all. First, allow me to commend every woman, every child initiative for having organized this very timely event. And I truly regret not being able to be here in presence with you this afternoon. The President of the General Assembly has asked me to facilitate the process, to prepare not only the high-level event on the 21st of September, but also to lead the negotiation to build a very strong, very powerful, if I may say, document where all heads of state, all member states of the United Nations would launch.
So unfortunately, due to technical difficulties, the rest of the video message cannot be played, so I'm going to read out the rest of the ambassador's statement, so bear with me. So as he was saying, all member states of the United Nations would launch and make commitments to fight the specter of drug resistance. We are facing indeed a global menace that threatens to take us back to the times before the discovery of penicillin. That is making us lose the gains attained in health and development. And that is jeopardizing the call to action of the UN Secretary General to end preventable deaths of women, children, and adolescents in a generation. Microbes are developing new forms of resistance every second and crossing borders with an impact beyond the health sector. I am certain that today's discussions will help us find diverse ways to reverse microbial resistance by promoting innovation, quality in health services, and focusing on vulnerable groups, among other recommendations. The Every Woman, Every Child movement's global strategy, to which Mexico is committed, was launched by the UN Secretary General last September, against the backdrop of the United Nations General Assembly and the adoption of the Sustainable Development Goals. The strategy offers us a unique platform of work across sectors that affect health, such as education, nutrition, sanitation, and hygiene, where more needs to be done with the support of multiple stakeholders. Next June 13, I will start informal consultations on AMR with member states, where I will have the opportunity to greet you personally and start together a process that will help us increase the global awareness on AMR, as well as improve our tools in order to decrease infections and build more resilient generations. So, now I would like to invite the Honourable Lord Jim O'Neill, our keynote speaker, to tell us about the final AMR review and its recommendations. The UK Prime Minister David Cameron commissioned the review on antimicrobial resistance in July 2014 to address the growing global problem of drug-resistant infections. It is chaired by Lord Jim O'Neill and backed by the Wellcome Trust and the UK government. Lord O'Neill is currently the Commercial Secretary to the Treasury and previously the Chief Economist at Goldman Sachs, where he famously coined the acronym BRICS. But to many of us in this room today, he is also now a key global champion for AMR. So over to you, Lord O'Neill.
Nana, thank you very much for those kind remarks, and thank you to yourself and all the other generous supporters for putting on this event and asking me to make a few remarks to you. So, honoured guests, ladies and gentlemen, let me get straight onto it, because I am going to just give you a flavour of our final recommendations, and hopefully, with the aid of this slightly complicated looking machine, I can get there, here we go, and leave ample time for those that really know about antimicrobial resistance to join me on a panel afterwards and discuss some of the issues that I raise and otherwise will have been raised. So let me step back, and I notice a few familiar faces in the audience and some dear friends of the past 2 years' journey. So I apologize to those of you that have seen some of this before. You can catch up with your messaging on your Blackberries and what have you while I do the first bit in particular. But for those of you not so familiar with where I arrived, just over 2 years ago, I received a telephone call when I was not a member of the government. I was just a private citizen enjoying my life, having a year previously to that step down from the almighty Goldman Sachs. I was actually going to a wine tasting evening in London with my wife, and my mobile rang, and a senior person from the UK Treasury said, "We want you to chair a review into AMR." And I said, "What is AMR?" And here I am 2 years later. It is quite possibly one of the most stimulating things intellectually I have ever done. And as I'm sure most of you are aware here, and Nano just touched on, it is exceptionally important and almost definitely probably the most important professional thing I've ever done. So I was asked to do this from an economist perspective. When I was asked, I said, why me? Why not somebody in health? And the answer was, if it stays just in the health space, then nothing is ever going to happen. We need somebody who pretends they know the world, who certainly talks globally, who can translate it into an economic and financial context in order for us to rid ourselves of this horrible threat. And that's what we started off doing, and that's what we've done throughout the whole exciting and important journey we've been on for the past 2 years. So, going right to the core issue that we addressed at the start. Many of you will be aware of a certain acronym being printed on my forehead for now close to 16 years as being Mr. BRICS. And so what I thought I would try to do is establish at the outset what the world might look like in the future with AMR as a problem and AMR solved. And so I deliberately, with the aid of my wonderful team, most of which are here in the audience with you, and a couple of consultants, we looked at the world of 2050, which is what made the BRICS thing so famous, both with AMR as a problem and AMR not as a problem. And what you see here is one of the two big takeaways, that if we don't do something about it, there is going to be 10 million people a year, that is 10 million people a year dying in another 35 years. As Nana was just introducing the session, I thought I'd also throw in a bit more scary colour. As we pointed out in our final report, in the 21 months that we existed, over 1 million people will have died from antimicrobial resistance around the world. And this actually translates, if this horrible scenario were to come to pass, I think it would be somebody dying every 3 seconds. Certainly more people dying from it than die of cancer today. But amongst the many reasons to make that analogy, think of the staggering contrast about how much initiative is thrown at cancer research right now and how little is thrown at AMR research. The second big takeaway was straight to the world that I had popularized, and this, can you see at the back, by the way, these pictures? There's some shaking heads. I could definitely not see with my aging years, so I shall try to highlight the clear parts. I see a few thumbs going on. What this shows you is how much economically the world will lose it otherwise could have had if we have the problems that go with 10 million deaths. And it is a staggering $100 trillion, that's 100 trillion, over the next 35 years. World economy today is somewhere between 70 and 80. And left to its normal devices, You would not think this was true if you read all the pessimistic stuff there is in the media every day these days, but left to its normal devices, in another 35 years, the world should be close to treble what its size is today. But if we don't solve this problem, $100 trillion, at least of that, won't happen. And remember that number, because the investment, most people call it a cost, but the investment to solve antimicrobial resistance that we recommend is extremely small compared to that 100 trillion. So what we did after we set out that horrible possible future is look at all the different issues that we thought we needed to focus on. And there were essentially, well, there were many, and there were some, I'm sure, that we haven't even thought of, but we highlighted 10. And these are the 10 some of which I'm going to go through as quickly as I can in terms of their specific relevance. Any clearer for you at the back? No? Okay. I shall make an effort. Sticking very much with the economist theme, of the 10 big issues, I would say 6 of them, 5.5, 6 of them, are what I'd call demand-reducing interventions, and 2.5, 3 of them are supply-boosting interventions. So in economics speak, we want to do things to boost the supply of effective and affordable drugs, and the demand-influencing things are things that will permanently reduce the demand for antimicrobials and antibiotics in particular. I do not have the time to go through all of them. I'm sure we have copies of our paper around. I see my colleagues' heads nodding, but I'm going to talk about some of them, particularly the ones that were so crucial in our final report and the ones that I really want to highlight. So, in some ways, and slightly contrary to the advice I'd been given at the start of our review, much of the advice was, you need to focus on how do we get more drugs, so boosting the supply. Pretty quickly, after this rather intensive discussion we had amongst our team, I came to the conclusion, I think we did, that arguably, the demand-reducing interventions are even more important because they would permanently shift the excessive use of antimicrobial things, in particular antibiotics. Whereas even if we get new drugs, at some point, we would become probably resistant to them. So let me go through some of them in particular. This is just repeating what I've just said. So and in our final report, there are 4 big things that we tried to highlight. 3 of them are demand-reducing things. 1 of them is a supply-boosting thing. Arguably, in my judgment, the single most important demand-reducing thing, none of them really are more important than the others, but if there were one, I might suggest it was this, and that is to introduce what I like to call Google for doctors. We need state-of-the-art technology in this space. We all wander around with these ridiculous things completely dominating our lives, and yet our medical practitioners essentially have an educated guess as to whether we need an antibiotic or not. That has to stop. We highlighted in a specialist report we did on diagnostics early on from a US research survey that perhaps as much as 2/3 of antibiotics prescribed are not necessary here in the States. 2 weeks before our final report, so in the past month, I think the Pew Trust and CDC jointly have highlighted, I read it in the Washington Post, another survey that said 1/3 were unnecessary. So we need to do something game-changing in this regard. If it's like that in the US, can you imagine what it's like in other parts of the world? So we came up with a number of specific areas here, but in particular, a very challenging one for Western countries, where if you look at the middle part here, we've suggested that by 2020, so that is less than 4 years away, we believe it should become mandatory in Western developed countries, to not allow antibiotics to be prescribed unless it has state-of-the-art diagnostic technology. Many people told us before we were going to recommend that you can't do that because it's not currently available and it's not cheap enough. But the only way of getting there is by doing something like this, so it unleashes the whole world of diagnostic technology, which, as I've just talked about, in every other part of our lives, that is taking place. Importantly, for those of you that come from the lower income countries, of which there will be many of you here, part of our recommended interventions for boosting research is to actually reward diagnostics developers in the emerging world for coming up with the right technologies specifically for them. We need to do something in animals also. Fascinating when I first started on this journey, given my background, and I know many people in the United States. When I first told people I knew what I was doing here, people said, when they got beyond the shock of what the hell are you doing something about health, interestingly, most people in the US said to me, oh yes, this is a real problem in animals and agriculture, which is a marked contrast to Europe, where most of the response is more to do with humans. I'm being told I have 2 minutes left, my goodness me. So we need to stop this. And we have suggested that starting in 2018, so the year after next, there should be a 10-year phased timetable for introducing overall limits of the use of antibiotics in agriculture, with a number of other interventions that support that make it far less demanding than probably at first thought many agricultural rich. You guys are good at this thing. I've got now a minute. You get the gist. That's agriculture. Thirdly, we need a global public awareness campaign. I could give you lots of anecdotes why we do. We need a serious, big global awareness campaign, adjusted for differences within nations. They're the 3 big demand interventions. There are many others we recommended. On the supply side, we need new, effective, the right drugs at an affordable price. Everybody knows the story about how difficult it is. I think there's some pharmaceutical companies in the room who can probably tell us more than anybody else as to how difficult and how expensive it is. These guys need to be rewarded or incentivized. So we have recommended something called a market entry reward that specifically gives money to the successful producer of the right needed new antibiotic, so long as they also agree to control its distribution in a much more sensible way than these things have been done in the past. We reckon $16 billion over a decade, listening to all sorts of expert advice, would get us the money we need for a generation of new effective drugs. And this is a chart showing how I put that together. If we can do that, and if we can find the right mechanism to pay for it, and we list a whole series of alternative ways of how you get that money, That in itself would probably open up the venture capital markets in the way it already thrives for virtually every other form of health research. Next steps, which is primarily why we are here. Nano, you touched on it. A lot of people say to me, what happens next? What are you going to be doing? And I say, ask me in October. Because there are two big things that need to happen between now and then. There needs to be a G20 agreement at this year's historic China-held G20 in September, I think it's the week before the UN, on how we get the right new drugs and how they are paid for. That, in my view, should be going on at the G20. In parallel to everything that Nano said earlier, we need a high-level agreement from the United Nations, and I think I heard the very generous Mexican ambassador say a powerful UN agreement. Help us get that. Thank you very much.
Thank you, Lord O'Neill, and I'd like to thank you for your leadership on this issue. I think this kind of leadership has really helped to elevate AMR globally, and particularly the AMR review has really placed AMR as an issue beyond just health and particularly squarely into the economic realm as well. So we are running a little bit over time, but we wanted to open up for a few questions from the floor. So we have time maybe for 2 questions. Please come to the microphone in the middle of the floor if you'd like to ask a question.
I did respect those messages. I only went 1 minute.
No, thank you. So please keep your question as short as possible so that there will be Q&A afterwards, the panel as well.
Okay, Lisa Burgess, UNICEF at headquarters level. I'm just interested in your report, sanitation and hygiene is mentioned as number 2, intervention number 2. I was wondering how are you packaging that into your overall messages, because it's the investments in WASH in several places. There was a meeting recently in London where we looked at the issue, and it's less than, I mean, if you look at the healthcare facilities that have the facilities, it is up to a third that don't have water, a little bit less have no sanitation, but it's not looking at functionality. And we learned from the medical groups that it's now antibiotics are being prescribed if women come for institutional delivery. So my question is, where does it fit in your package, your call for action?
Thank you. Next question, please.
Hi, thank you. My name is Suri Moon from the Harvard School of Public Health. And I think one of the themes that runs through your report is the importance of public leadership, and we can all certainly agree on that. It also seems very clear that we need a lot of public money to combat the threat of AMR, including in the global R&D fund that you're proposing. It's very exciting that at least 2 governments have already stepped forward. What I was wondering was if you could speak a bit about the concept of public return on public investment. And so if public money is going into this fund, how do we ensure, for example, that the global public is able to access the antibiotics that emerge at an affordable price, and that's the public not only in high-income countries, but low and middle-income countries as well? Secondly, how do we ensure that some of the experiments and new approaches to R&D that are actually considered to be more efficient, such as open innovation models, might be supported by an R&D fund? There have been many, many debates at the World Health Organization, for example, on how to improve and fix a broken R&D system, and the AMR experience seems to be a very important opportunity to do that. Thanks.
Great, thank you so much. Gary, did you want to? Okay, last question from Gary Cohen.
Well, thank you for the excellent and alarming talk about what's coming. Did the panel look at what happens in hospitals? I was reminded recently that before antibiotics, hospitals were places where people went to die from infection. And the spread of infection in hospitals associated with healthcare-associated infections and some of the more virulent infections is significant. Did the panel look at hospital practices, infection control, and so forth? Thank you.
Okay, shall I?
Yeah, sorry, Gary is from BD, Becton Dickinson.
So I'll let me take the last one first. The answer to that is yes. We specifically discussed infection control in one of the 6 specialist papers we published before the final reports. and we touch on that and have some specific recommendations. I think we had 29 specific recommendations in total. Obviously, given the time, I don't have a chance to go through them all, but the answer is yes. And we highlight some important examples of how to deal with this better, with just basic good practice of how hospitals should be run. And we cite examples of where some applications of that have, at least temporarily, if not for longer periods, worked in parts of the world. Which let me work backwards on the very interesting second question about return on investment, particularly public investments. I could speak for hours about this, but in its broadest sense, and especially now coinciding with the fact I happen to be a serving minister in a finance ministry in one of the G20 countries. 2 years ago in Brisbane, I guess it was, the G20 made a rather bold statement about boosting global infrastructure to boost global GDP by 2%. If you turn the 100 trillion lost as to what we could get, the total interventions that we have recommended is $40 billion. We've vaguely costed it over a decade. That is less than 0.25% of global GDP. And if that plays its role in creating $100 trillion worth of global outputs, and with it wealth and equality that would go with it that otherwise wouldn't be in place, as one of my old hedge fund pals told me when he saw our final report, every investment manager in the planet would give plenty to get even a smidgen of that kind of return. It's something like 2,500% return. And importantly, that $40 billion does not all need to be public money. That is this is partly why the G20 is the right place for the discussion about how we get the right new drugs and how we pay for it. But even if it were all public money, that is a pretty spectacular return, and it's happening at a time where so many countries around the world seem to be struggling to achieve their growth potential. And it's led to me thinking, not least because I never thought about these things before, that investment in health should be regarded as one of the main infrastructure investments, particularly, of course, in the so-called emerging world, which takes me to the first question and another aspect of the second one, really. We also did part of the same thing about infection control. We looked at sanitation and health. And, of course, given the remarkably admirable goals of the Sustainable Development Goals that the UN agreed on and brought into passing, less than a year ago, doing what is necessary on sanitation and health in itself is a massive part of solving antimicrobial resistance. With the help of some very bright postgrad students at the LSE, we highlighted some work they did looking at diarrhea in some high population, low-income countries, and showed that with the right sanitation and clean water, you would cut what in any case were idiotically inappropriate antibiotic usage for diarrhea by something like nearly 70%. And in our judgments, this just adds to why achieving those parts of the Sustainable Development Goals are so important. I can't resist in also adding, at a time when there is so much focus on issues to do with income and wealth equality or lack of it, a lot of people often think the UN does make very grandiose, bold goals, but doesn't achieve them. Of course, the UN's announced plans to halve global poverty in the Millennium Goals actually achieved that goal 5 years quicker than they announced. So with the right focus, these things can be achieved, and I think just doing that would have a huge, huge impact on solving antimicrobial resistance. Okay, thank you very much.
Thank you, Lord Nick. Great. So we are now, I'm handing over to the next segment of the program, and I'd like to invite our panel members up to the stage. I'd now like to call on Professor Anthony So, who directs the Strategic Policy Program for REACT Action on Antibiotic Resistance and Johns Hopkins Center for Livable Future, to lead the panel discussion. Professor So is a respected expert on the issue of AMR. He has served on the Lancet Infectious Disease Commission on Antibiotic Resistance and the Institute for Medicine's Committee on Accelerating Rare Disease Research and Orphan Product Development. He's also chaired the WHO Working Group on Antimicrobial Resistance and was part of the Antibiotic Resistance Working Group of the US President's Council Advisors in Science and Technology. So after the 5 panelists' presentation, we will hear also commentaries from 2 esteemed experts, Dame Sally Davies and Dr. Keiji Fukuda from WHO. And then Professor So will moderate a Q&A discussion, interactive dialogue with all of you. So Professor So, over to you.
Thank you, Nana and Lord O'Neill, for setting the stage for today's discussions so ably. True to the title of this briefing, our panelists will address the multisectoral challenge of antimicrobial resistance. Each brings a unique perspective, and we hope that their remarks in composite will provide a useful context and perspective, as well as years, if not decades, of relevant experience, both on the important recommendations laid out in the UK review on AMR and in other proposals put forward by key stakeholders who have worked on these issues. Now, no doubt, we cannot do justice in the space of 2 hours to the full spectrum of perspectives that rightly deserve a place on this panel. Healthcare delivery systems, academic research centers, the pharmaceutical industry, drug regulatory agencies, agribusiness, and of course, the providers and patients, as well as others. Many, of course, of these perspectives are represented in the audience, and we hope to have an opportunity later in their session for their interventions. But we do trust that this briefing will help advance the discussions already underway on the road to a high-level meeting on AMR at the time of the UN General Assembly this September. Antimicrobial resistance threatens the progress towards attaining several sustainable development goals. And these implications go beyond healthcare to, of course, food systems and the environment. We will only achieve meaningful universal health coverage and reduce the burden of communicable diseases, both under SDG 3, if our patients have access to essentially effective antibiotics and if we all conserve the use of these life-saving drugs. And we will only have a system of responsible, sustainable consumption and production under SDG 12 if we can curb the non-therapeutic use of antibiotics. As Nana mentioned, we will have a panel of 5 speakers, 2 of whom will focus on the issues of innovation, access, and conservation, issues that typically fall more so on the human side of antibiotic use. And the balance of the speakers who will address the use of antibiotics on the agricultural side. The panel will be followed by reflections from, of course, our 2 distinguished discussants, Dame Sally Davies and Keiji Fukuda. Now, in setting the stage for our first 2 speakers, I would like to outline a few key principles. The effectiveness of our response in meeting the challenge of antimicrobial resistance rests on our ability to address the tripod of innovation, stewardship, and access. On innovation, we have to bring truly novel and effective classes of antibiotics to market. What we have in the R&D pipeline clearly falls short of what we will need. What has come onto the market has too often disappointed not only healthcare providers, but also the industry. Between 1980 and 2009, over 40% of systemic antibiotics were withdrawn from the US market. And most of these were withdrawn not for safety reasons, but probably because they were little value added against existing drugs. The rate of antibiotic withdrawal from the marketplace is over 3 times greater than other therapeutic categories. So when you hear of the low returns among antibiotics, those averages reflect these withdrawn antibiotics as well. Of note, 2 first-in-class antibiotics, linezolid and daptomycin, came to market before new incentives were in place, and both command impressive prices. And despite market sizes in the range of 140 to 180,000 patients per year, well below the orphan drug cut point, these two drugs have sales that place them among the top 100 US drugs on the marketplace. Not bad positioning for these truly novel, first-in-class antibiotics. If one studies the R&D pipeline, though, for antibiotics, a fundamental challenge remains: the upstream scientific bottleneck. After all, the dearth of novel antibiotics begins with drug discovery, and there's a tenfold lower yield in the drug discovery phase of identifying promising drug leads when comparing antibiotics to all other therapeutic drug categories. On stewardship, drug companies face the economic conundrum that a breakthrough antibiotic would be conserved. That is, we in the healthcare system would only want them to use it sparingly, only when absolutely necessary, lest drug resistance emerge rapidly to its use. The promise of a small market is understandably not a winning value proposition. And the final part of the tripod, access. If these drugs are not available nor affordable to those in need, patients will not benefit, and there will not be fair returns on the public investment to bring such drugs to market. So the principle of delinkage, separating the returns on investment from volume-based revenues on a drug, or in other words, from price and quantity, has emerged. The UK review on AMR has put forward a rich set of proposals to address some of these concerns. These include a global innovation fund for early stage and non-commercial R&D, late stage market entry rewards, as Lord O'Neill had mentioned, a pay-or-play proposal for the pharmaceutical industry, and top-up payments for diagnostics for low and middle income countries. On innovation, we might ask, do these incentives help transform the innovation ecosystem for antibiotics? Or are we still hoping that company by company, drug by drug, to enable the private sector to deliver new antibiotics? Will these incentives lead to a system of sustainable production and consumption of antibiotics? On stewardship, what incentive approaches might enable us to delink return on investment from volume-based revenues so that the economic incentives in the system line up with access but not excess? And on access, do these approaches move us towards a more equitable system of distributing and delivering affordably these life-saving drugs to those in need? To help us think through these issues, I'm delighted to invite Precious Matsoso, Director General of the National Department of Health of South Africa, and Rohit Malpani, Director of Policy and Analysis of Médecins Sans Frontières Access Campaign, to offer their reflections. We have asked each panelist to keep their remarks to 7 minutes. Not to take away from their time, may I refer you to the program where their bio sketches will show the depth and breadth of their expertise they collectively bring to the topic before us. Drawing on years of experience in various roles, including chair of the WHO Executive Board, member of the UN High-Level Panel on Access to Medicines, and former WHO Director for the implementation of the Global Strategy and Plan of Action of Public Health, Innovation, and Intellectual Property, may I now invite the Honorable Madame Matsoso to offer her reflections.
Good afternoon. AMR is a global problem. It needs a multilateral response. It needs no visa. It knows no boundaries, no borders. Professor Ramanan, indeed, it needs a collective response, and in particular, a multilateral response. But we also need public health measures. We must address social determinants of health, community-based interventions, as well as health systems-related interventions. And those health systems-related interventions are about fostering innovation and facilitating access. In facilitating access, we need to ensure therapeutic access. Therapeutic access is about ensuring that those medicines, those antibiotics, those antimicrobial agents are available in pediatric form for children. They're available, but also they're restricted in use. They cannot be widely available because increase in availability is also a problem on its own, in that increase means increase in consumption, and increase in consumption means increase in sale. So we have to deal with both barriers to access, barriers to innovation, whether they be scientific, technical, regulatory, legal, administrative, as well as some of the measures we've seen in some of the countries with regard to litigation. And with regard to litigation, we've seen 2 newer antibiotics which had to be withdrawn from the market precisely because of that. There's been a plethora of innovative ideas, including in the review report, of coming up with mechanisms of funding. But I'd like to raise 3 specific issues that require attention. That these plethora of initiatives on funding for antimicrobial research and development required coordination. And in coordination, we must set up some governance structures and mechanisms, ensure that there are some principles that deal with transparency as well as sustainability, long-term sustainability. And in achieving that, we'll ensure that some of these financial barriers that we see can be addressed. But of importance, we need to ensure that, and I would like to use the South African example. In South Africa, I actually say that we've got triple burden, a triple burden of resistance. Resistance to HIV because we've rolled out treatment to 3.4 million people, resistance to TB treatment, anti-TB drugs, and resistance to antimicrobial agents. So with that triple burden, we have to ensure that we address each instance and also each particular area differently. Differently because with regard to TB and HIV, the problem is not that of access. The problem is that of scaling up. You need to put more people on treatment. With antibiotics, it's the different problem. It's about misuse, it's about excessive use, so you need to contain excessive use. So we have to approach these problems differently. And I'd like to raise that for other countries, of course, because we want to leave no one behind within the context of the Sustainable Development Goals. We have to deal with social factors. Social factors are not just about sanitation, clean water. It's also about immunizing children and ensuring that affordable vaccines are available. It's also dealing with overcrowding with regard to tuberculosis. It doesn't help to treat TB when it continues to be spread because of overcrowding. I would like to say that we welcome the proposals that have been highlighted in the review report, particularly financing, and to emphasize that we need to ensure that there's coordination, because there is also a BARDA initiated by the US, there's a GARD that has just been launched, which is led by DNDi, and also a whole lot of other initiatives. If we can just create that mechanism of coordinating. Secondly, advocacy. I wouldn't agree more that this is a society-wide response. Because it is a society-wide response, it requires a response by everyone. And in that regard, we'll be able to respond. Let's ensure that there's open source so that we can support innovation. Let's promote partnerships so that there can be product development partnerships, both in developed and developing countries. And let's promote the principle and concept of de-linkage so that medicines can not only be developed, they can also be accessed, they can be affordable, particularly for those who need them. How quick we use this and how quick we respond will be able to reduce the burden of disease. Let me warn all of you in this room. 1/3 of the world population has latent TB. So half of you, or 1/3 in this room, have latent TB. So let's all respond and ensure that we can be treated timely with appropriate treatments. Thank you.
Thank you, Madam Matsoso. Your remarks remind us of the challenge in moving life-saving antibiotics from bench to bedside. Certainly the importance, of course, of maintaining the right formulations for children. Certainly the challenge is certainly right safeguards for both safety and, of course, conservation, the need for coordination, financing, and also considering that the different manifestations of resistance and how we might deal with these issues. May I invite Mr. Rohit Malpani to offer his reflections from his wealth of experience as the former senior campaign advisor at Oxfam and his current role as the Director of Policy and Access Access for the Access Campaign at Médecins Sans Frontières.
Thank you for providing MSF the invitation to speak. MSF is an independent humanitarian organization providing impartial medical assistance in more than 70 countries to people affected by wars, natural disasters, disease outbreaks, and economic exclusion. Drug-resistant infections are a looming challenge for our work today. We see them in the war-wounded people we treat in Jordan, in newborns in Niger, and in people in our burns unit in Iraq. Our medical staff is increasingly seeing people with infections that can only be treated with the last lines of antibiotics. There are many challenges to address in tackling antimicrobial resistance, and MSF welcomes the AMR Review's broad global approach. The report confirms what MSF has long voiced, that the current system of pharmaceutical research and development, based on monopolies and high prices, does not develop and deliver the drugs, vaccines, and diagnostics we often need. And when new medical tools are developed, they are often unaffordable or not suitable for the people and contexts which need them the most. So we'd like to make 5 observations for today. First, although we welcome efforts to foster new investments and approaches to research and development for unmet needs, these measures will not have any impact unless governments and the World Health Organization assume the central role in identifying gaps, guiding priority setting, and ultimately managing new research and development funding. We think the report could have issued a clear recommendation supporting such a mechanism. This matters to us since only governments can ensure that the needs of neglected and vulnerable patients are not left behind. The report highlighted the need for new drugs and diagnostics to address TB, yet we cannot be confident that despite the significant morbidity or mortality associated with the disease, that it will be appropriately prioritized. This is due to the fact that TB, simply put, is especially prevalent in low and middle income countries. So if we introduce a system of priority setting based on who can pay the most, or exert the most influence, or simply leave it to companies to decide, we will simply reinforce the failures of the current system of research and development and not correct them. Second, even as we acknowledge efforts in the report to highlight the importance of access, urgent action that goes beyond the report's recommendations of voluntary action, in particular government action, is required to expand access to existing drugs and vaccines. Today, more people are dying for lack of access to existing appropriate drugs and vaccines, not from drug resistance. The pneumococcal vaccine, or PCV, which is sold by only Pfizer and GlaxoSmithKline, is one example of an unaffordable vaccine. Even in the poorest countries, PCV accounts for approximately 45% of the total cost to vaccinate a child. Why does PCV matter? PCV protects against pneumococcal disease, which kills approximately 1 million children every year. It is estimated that universal coverage of PCV could result in a 47% reduction in antibiotic use in people with pneumococcal infection. Today, just under a third of people globally are protected with PCV. To maximize the potential of this vaccine, we need dramatic price reductions and competition. Third, while MSF welcomes the efforts of the report to identify and propose alternative models of research and development, the report at times does not propose models that truly safeguard affordable access for new medical tools. In particular, the report does not always fully support delinking or separating the cost of research and development from sales volumes, and most importantly, the end product price. Delinkage is often limited in the report to particular diseases or only applied to low and middle income countries. This means that even though new drugs may be conserved, they may not be affordable for all people. Companies could be paid at least twice, via market entry rewards of approximately $1 to $1.5 billion, and a second time through an opportunity to sell drugs at higher prices. The report proposes slightly different models to develop new diagnostics and vaccines, yet as with Gavi's advanced market commitment, the proposed subsidies may not be efficient nor safeguard affordable access. One example where the report supports delinkage in its entirety is a mention of a new model of TB drug development that MSF has championed, the 3Ps project, also known as push, pull, and pool. We think this is an effective way to deliver short course, less toxic, and affordable combination treatments for all forms of TB. Fourth, we stress the importance of policy coherence. We note that alongside the UN Special Session on Antimicrobial Resistance, the WHO continues to advance government-led efforts on research and development through the Consultative Expert Working Group, and the UN General Assembly may consider a new report being written by a UN high-level panel on access to medicines, which was commissioned by the UN Secretary General. The high-level panel seeks to recommend solutions to the broader research and development crises of unaffordable prices and a lack of innovation to address priority health needs. We hope missions in New York connect the dots between these three processes. Finally, we are concerned that global health security is driving our fight against antimicrobial resistance. While such a framing may be an effective means to call governments to action, it can lead governments to focus on solutions that only seek to protect their own people, rather than ensuring affordable, effective, and appropriate medical interventions for all. We welcome the report for building attention to this problem, and we hope that government action at the UN Special Session in September and beyond will ensure coordinated political commitment to make urgent challenges to introduce a new global R&D framework that puts patient needs first. Thank you.
Thank you, Mr. Malpani. You clearly called out, I think, some very important issues, the need for priority setting, particularly to ensure that particular diseases such as TB are in fact dealt with appropriately, to expand access actually to complementary technologies which could decrease the selective pressure on drugs such as vaccines for pneumococcal disease, and the importance of alternative models such as 3Ps that could be financed actually through the opportunity of working on antibiotic resistance. Importantly, also note the issue and importance of policy coherence, which we can see clearly as we see several processes now converging, which include the CEWG process and resolution recently adopted at the World Health Assembly, the work of the UN High-Level Panel on Access to Medicines, and the upcoming UN High-Level meeting on AMR in September. So we will see a convergence of a lot of these issues, as well as, of course, the importance of beyond the impetus that global health security might give us the initial momentum, that we must, of course, consider this in the larger context of those whom we are trying to actually deliver antibiotics so that their needs will be met. Our first two speakers have highlighted some of the key challenges and opportunities ensuring innovation, stewardship, and access, how the UK review on AMR proposals might support these goals, and where we might go further or even take some different directions. Our next three speakers will offer insights on how antibiotics might be used more sustainably in the food production system. Antibiotics have a dual market, both in humans and in animals. What is widely recognized is their resistance to a drug used in animals can confer resistance to bacteria in humans. And there are several routes for this transmission from animals to humans. This, of course, occurs through contaminated food products to consumers, but also can be transmitted to workers along the food supply chain. Resistant bacteria can also spread through farm waste and runoff, or be carried by flies, rodents, and even migratory birds. There are no borders that contain the spread of drug-resistant bacteria. We all recognize the importance that antibiotics play not only in treating diseased animals, but ensuring a healthy, sustainable food system. However, the use of critically important antimicrobials for growth promotion, for prophylaxis, for offsetting poor hygienic conditions, risks squandering these precious societal resources. To be clear, it will not be enough to just curb the agricultural use of antimicrobials important to human medicine. Other antibiotics not used in human medicine can cause cross-resistance to those medically important drugs. Of great concern, an analysis commissioned by the OECD, the Organization for Economic Cooperation and Development, projects that global antimicrobial consumption of food animal production will climb by 67% between 2010 and 2030. Of this increase, 2/3 will come from a larger number of food animals in production, meeting the increasing need for meat consumption in our world. And 1/3 of this increase traces to the transition to a more intensive animal production system, where thousands of animals are kept in high-density facilities, conditions where antibiotics have been used in greater amounts. Most worrisome has been the emergence of resistance to colistin, a drug used as one of the last-line defenses against drug-resistant infections in human medicine. This past November, investigators reported the startling finding in China of plasmid-mediated resistance to colistin. They had noticed an increase in colistin resistance in China in recent years and wondered if a new mechanism, spreading such resistance from bacteria to bacteria, could have emerged. Taking samples from pig slaughterhouses, retail meats, and 2 tertiary hospitals, they discovered MCR1, the first ever documented finding of plasmid-mediated resistance to colistin, a finding that sent shockwaves through the global medical community. Colistin is seldom used to treat systemic infection in human medicine because of its known toxicity, except as a last resort. But polymyxins, of which colistin is one, is the 5th most commonly sold drug for food animal production across 19 European Union countries where such sales data are available. And in the past few weeks, news that the first such case of colistin resistance has been found here in the United States. That would bring the number of countries now with documented colistin resistance in either food animals or humans to at least 20. The UK AMR review touches upon antibiotic use in agriculture in several of its recommendations. It calls for countries, 1, to set targets to lower antimicrobial use in agriculture over 10 years, to set restrictions on critically important antimicrobials in food animal production, to improve the transparency of antimicrobial use in the food industry, to develop a global surveillance network for monitoring antimicrobial resistance in food animals, to increase the use of vaccines and other alternatives in food animals, and to further strengthen the veterinary workforce, so critical to managing effectively the use of these drugs in food animal production. The growing tripartite collaboration among the World Health Organization, the World Organization for Animal Health, and the Food and Agriculture Organization is an important touchstone. We all must begin working across sectors and with a One Health approach on these issues. On these issues, we turn to Steve Roach, Food Safety Officer for the Food Animals Concerns Trust, Professor Jaap Wagenaar, Professor of Clinical Infectology at Utrecht University in the Netherlands, and Dr. Yong Kim, Director of the Animal Health Management Division for the Ministry of Agriculture for Food and Rural Affairs of the Republic of Korea. I'll begin with Steve Roach, a senior advisor for the Keep Antibiotics Working Coalition and as a member of the Antibiotic Resistance Coalition. Mr. Steve Roach brings an important perspective informed by his roles as Consumers International's representative to various Codex Alimentarius committees and as a member of the WHO Advisory Group on Integrated Surveillance on Antimicrobial Resistance. Steve?
Yeah, I would like to thank the organizers for inviting me here today. And I'm going to present a perspective from civil society, or as we kind of see ourselves here, as consumer advocate organizations on antibiotic resistance and its relationship to animal agriculture. As Professor So mentioned, just recently, starting last November, we found the detection of colistin resistance in food animals, in food, and in sick patients. And this was did send shockwaves around the world, and it's just been a couple weeks since we had the first human patient reported in the United States. And at the same time, there was a report of a case, transmissible colistin resistance, also found in a pig in the United States. So the food-animal connection is definitely there. But this is just the last of a long line of resistance that we didn't expect, but then ended up finding in food animals. For a long time, we were primarily concerned about ampicillin and tetracycline resistance because these were the drugs that we used to treat infections like Salmonella and Campylobacter that you were likely to get from food animals. Then starting around 2000, we started finding resistance to cephalosporins and fluoroquinolones. These were the drugs that you used because you expected that you were going to already have your Salmonella was going to be ampicillin resistant. So we'd switch to cephalosporin and fluoroquinolones. Now we've moved on to, now we're finding if you have resistance to those two, where do you go to? And where you go to is carbapenems and colistin. And now we find resistance in food animals and in food to both of these as well. So it's a big problem. I think the AMR review report makes some good recommendations what to do. Our perspective is generally that we need to use less antibiotics in food production. We know there's a lot of overuse in humans, and there's equally the same amount of overuse in food animals. So one thing we need to do is set targets for reductions in use. And we think that is totally appropriate. Countries where it has been done, and we'll hear some about that, it has shown that it can drastically reduce use. And we can also show pretty clearly when you compare across countries that reducing use can have pretty significant impacts on resistance in food animals, in food, and in sick people. A good example is in the US, we restricted the use of fluoroquinolones in poultry in the United States, something they didn't do in Europe. And if you compare fluoroquinolone resistance in Salmonella and Campylobacter, things you actually catch from poultry, it's much lower in the United States than in Europe. And then there's other parts of the world where it's even much higher. Almost you're getting up very high percentages. So setting targets is important, but when we set targets, we really need to be careful that we take care of the disparate impacts. So we don't want to basically bias it so that we're only helping very large producers or multinational corporations. We also need to think about how setting targets may have impacts between different countries in their ability to produce food. something we've long argued for is restrictions on use. And generally, none of the groups that I work with say that we should not use antibiotics in food animals. Sometimes we're misrepresented as saying that. No, but we think there should be targeted restrictions. And there are drugs that probably should not be used in food animals. And from my perspective, colistin is probably a drug we should not be using in food animals. Carbapenems we probably should not be using in food animals. So, but right now we need to have an international mechanism so that we can develop consensus on what are these drugs. There has been some guidance from the World Health Organization, but I think we need to really set up standards for that. But as well as saying drugs that we shouldn't use, we also need more guidance on things we shouldn't do with most of the drugs. And I think one of the things that has been recognized, and the World Health Organization recommended back in 2000 that we not use these things for growth promotion, basically to reduce the cost of feeding animals. And I think that is correct, but we've also learned that we probably do not want to use those for routine disease prevention either, and that can cause problems as well. And I think in the Netherlands, they found that if you only just restrict growth promoters, it can have no effect or very limited effect. So I think we need strong international guidance. Later this month, there will be a Codex Alimentarius meeting, and there will be a decision whether Codex will move forward with other actions related to antimicrobial resistance. And I hope that that does move forward. But I hope that we can get out of Codex in the coming years actually stronger guidance saying do not use these drugs, do not use these drugs for these purposes. So also transparency is very important. A lot of the groups I work with, we have done campaigns targeting fast food companies, asking them to develop policies on antimicrobial resistance. And you may have heard of that in the news. We've had, over the last year, we've had numerous of the United States-based companies making commitments to reduce antibiotic use in their meat suppliers. And I think that can be very helpful. But it really needs to be put in the context of, it's helpful, it moves the ball. But we really think we need strong international standards and also regulations in countries. And sadly, there was a recent OIE report that 110 out of 130 countries surveyed basically found they do not have adequate regulation of use of veterinary drugs in their countries. So I think that's a very big problem. Monitoring is important, but monitoring really needs to be useful for doing something. We don't just want to monitor, we need to guide, use monitoring to guide actions and take actions and see how well our actions are working. So, thank you.
Thank you, Mr. Roach, for sharing these important framing perspectives. Next, from the vantage point of a country where the second largest export trade of agricultural products in the world, Professor Jaap Wagenaar will offer reflections from the Netherlands' experience in reducing antimicrobial use by 70% in the agricultural sector.
Thank you. I'd like to thank the organizers for inviting the Netherlands to present our successful program on antimicrobial usage reduction in animal production. Less than a decade ago, there were a couple of triggers in the Dutch Agricultural Society that made the basis to develop a program and a policy to reduce antimicrobial use in animal production. One of the triggers was the publication of two publications, and one was that in the Netherlands, at the human side, the prescription is almost the lowest when we look to European countries, whereas at the veterinary side, animal side, we were the highest compared with 10 other European countries. That was really a signal that something has to be done at the animal side. Other triggers were the emergence of the development of resistance bacteria in the animal production. And for example, the MRSA was an example, livestock-associated MRSA. And the risk of transfer to humans through the food chain, to the environment, or through direct contact. There was also a more general concern about the intensification of our production in the Netherlands. And one of the not AMR-related issues was the largest Q fever outbreak related to milk goats. And that gave in the society a real concern about our animal production. And our animal production is large. As said, we are the second largest exporter of agricultural products in the world. We have a huge animal density on a very small surface. We are only 1/10 of the state of California. Finally, we decided to do something, and that is all based on the precautional principle. So we do not have quantitative data what the attribution is from the use in animals on the problem in humans. But there was we did not stop with doing something. So everybody who was acting had that as the starting point, the precautionary principle. What are the key elements of the reduction policy? First, the ministry set the reduction targets. So they said to the animal production in 2011 only 20% less, in 2013 50% less, and in 2015 70% less compared to 2009. They ask for a full transparency so that we know from all the animal production sites how much antimicrobials they are using. We installed the Veterinary Medicine Authority. That's an independent body that set the targets for the animal production. So what is allowed to use in the different animal sectors. And when we started with that, we simply had a distribution of farms and their ADDDs, so what they use in their animals. And we simply set as a target the 25% highest users should act immediately and reduce their antimicrobial usage. There is self-regulation by the private sector, and there is public surveillance and enforcement of the law by the government. But the self-regulation is extremely important. It's organized by the production sectors. And what I said about the red farms, the farms that use too much antimicrobials, when I give an example of that, that's in the dairy industry. When a dairy farmer uses too much antimicrobials, it's above the target, then the dairy company, the dairy factory, said to that farmer, we will not accept your milk any longer if you do not reduce the antimicrobial usage. And that's a very good economic incentive for a farmer really to act. The government, the role of the government, they set targets, what I said, the 20, 50 and 70% targets. They had a stringent enforcement of their law. And the laws, there were new laws, was the ban on prophylactic use, the fact that antimicrobials can only administered by veterinarians and only in very exceptional cases and very strict conditions. There are exceptions for that with farmers. And there is a susceptibility testing when they want to use the critically important antimicrobials like fluoroquinolones and the third and fourth generation cephalosporins. And not simply doing an antibiogram, but showing that there are no alternatives possible there. Then the effect of the policy. We managed to have a 65% reduction in antimicrobial use in animals, the sales data, from 2007 to 2014. And compared with the reference year of 2009, it's 58%, 2009 compared to 2014. And the use of fluoroquinolones and cephalosporins are reduced to really a few kilograms in the whole animal production. We are now in the middle of, or maybe even the lowest part of the usage in animal production in the Netherlands, or in Europe. We see the effect on the reduction in resistance in our surveillance system, in the commensal E. coli. So we really see the effect, usage followed by the reduction of resistance. The key factors for success were the actions taken by all the parties involved, and meaning commitment from the industry, the government, veterinarians, scientists, and the Veterinary Medicine Authority. We had a One Health approach, collaboration between agriculture and public health, really on all levels, on ministerial level, but also scientists and other organizations. A prerequisite is that the private sector is well organized, enabling public-private cooperation, and we use their production chain quality system to have their self-regulation in these animal production sites. The summary is, there is a huge reduction, is possible, and is feasible, and it also shows that there is a reduction of resistance. There is a change in the attitude of Dutch farmers regarding the use of antimicrobials, and they are not any longer using antimicrobials as a management tool on their farms, but they change to biosecurity and vaccination. So the reduction has shown to be possible in a country where a very large and intensive livestock sector is present. We are the second exporter of agricultural products in the world. We like to do that in the future, and it's possible with less antimicrobials. Thank you.
Thank you, Professor Wagenaar. I would also point out that the experience and exemplar of the Netherlands is mirrored among some of its European community neighbors, including Sweden and Denmark, of course, which have also made impressive progress on this front. And I will now invite our final panel speaker, Dr. Yong Kim from the Republic of Korea, to offer his remarks on the experience of his country in implementing policies to curb antimicrobial use in food animal production.
Thank you. It's my great pleasure to give you our experience regarding AMR, especially at the animal sector. When it comes to AMR, let me go back to 2002 and 2003. At the time in Korea, there were lots of controversies among the public and the media regarding misuse and overuse of antimicrobials in livestock sector. One of the consumer organizations opened their survey result that by the press release that 18 major food, including beef, pork, and fisheries, were heavily contaminated with multi-drug resistant bacteria in Korea. 100% of Salmonella isolate showed resistance to one or more antimicrobials. Furthermore, 63% of Salmonella isolate showed resistance, even 4 or more. And the theories of AMR issues hit the headlines in most of our mass media. In 2003, the government launched the Intergovernmental and Multidisciplinary National AMR Management Program, which covers both human and non-human sector. Based on the program, the government carried out 10-year period national project on AMR from 2003 to 2012. Main activities of the project includes organizing national advisory committee, developing a monitoring program on antimicrobial consumption and on resistance in clinical livestock and fishery sectors, implementing of risk management measures on AMR in livestock sector and fishery sectors, investigating AMR in foods, establishing the national surveillance network, and so on. In terms of the main barriers to combat AMR in Korea, firstly, there was strong opposition from livestock farmer organization. They argued if regulation limit the use of antimicrobials in animal feed, the livestock industry would be badly affected due to the increase of production costs, the usage of therapeutic antimicrobials, disease incidence, and so on. As one of the measures to overcome this barrier, the government has been providing financial support to farmers, which are only accredited to comply with relevant regulation on prudent use of animal drugs since 2009. And the government has been encouraging the livestock industry to apply for good animal practice and the HACCP concept, which need less antimicrobials during production stage. Secondly, farmers had increased the use of antimicrobials in feed and water during breeding, and farmers also get used to inject antimicrobials into their livestock directly after purchase from animal drug store without any veterinary prescription. In 2001, it was 45%, but 2007, 55%, and even in 2011, it reached 78%. To make it worse, at those times, there was no significant veterinary oversight system. To overcome this barrier, the government introduced several measures, such as phased ban of antibiotics in feed and phased veterinary drugs prescription system. There are two main actions of AMR controls in livestock. One was to strengthen the national monitoring program. Due to that, the government established the Korea veterinary AMR monitoring system in 2003. And the other one was to implement more strong regulation on antimicrobials. In 2004, official AMR committee decided the ban of antibiotic addition in animal feed by steps. Before 2005, 44 antibiotics were allowed in animal feed. In 2003, only 16. And in 2009, only 9 were allowed. And finally, in 2011, none of antibiotics were allowed in animal feed by regulation. During the period, there had been strong and consistent push and support from the public, in particular from the consumer organizations. As a result of the past antibiotics ban in commercial animal feed, the consumption of antimicrobials in livestock sector has dramatically been decreased between 2007 and 2011 from 1,500 tons to below 1,000 tons. 1/3 has gone. Some recent studies shows that resistance rate of E. coli isolated from healthy animals and the animal carcass against tetracycline, streptomycin, sulfonamide had been decreased between 2007 and 2015. And also the Enterococcus species and Campylobacter jejuni showed a similar trend. At this time, there are many potential problems in dealing with AMR methods in Korea. For example, increase of usage and resistance of therapeutic antimicrobials, in particular fluoroquinolones and third-generation cephalosporins. Increase of disease incidence in pigs and chickens could drive increase of antibiotic use, and so on. Finally, I would like to mention the way we are moving forward on AMR. I think that the effective, persistent, and strong intergovernmental and multidisciplinary leadership is essential to combat AMR. We need more extensive monitoring system on AMR. We also need to strengthen laboratory capacity building and a wide range of basic studies on AMR as well. Secondly, I think proper use and less use of antimicrobials are key approaches. To that, we can focus our resources into strict control for antibiotics use, residue control in edible animal products, effective disease control at farms, improving of public awareness of AMR. AMR issues is one health issues which are closely related to human, animal, and environmental health. So close cooperation is necessary in combating AMR not only at national level, but also at international level. Thank you.
Thank you, Dr. Kim, for sharing this example from Asia of your country's important efforts and some, of course, of the stakeholder dynamics actually that have led to these stepwise policy advances. The last three speakers have laid out a portrait of the challenge of antimicrobial use in the agricultural sector amidst, of course, the receding frontier of effective antimicrobials and antibiotics. And, of course, the exemplar of both the Netherlands and the Republic of Korea clearly shows, of course, two very different countries that have, of course, grappled with this issue and effectively so in taking these steps forward, as well as the application of the precautionary principle and the One Health approach and the intersectoral collaboration required for accomplishing these ends. From the vantage point of human and animal health, our five presenters have commendably suggested where we might build upon the UK review on AMR's recommendations, where we might go further, and where we might even take different steps. Tackling the multisectoral challenge of antimicrobial resistance, we now turn to two champions of these global efforts and ask them to chart where we would need to see next, actually, particularly here in the UN process leading to the high-level meeting in September. First, we will hear from Dame Sally Davies, who serves as Chief Medical Officer for England and the Chief Medical Advisor to the UK government on medical matters. Her tireless advocacy on antibiotic resistance is well known to us, from her role in the WHO Executive Board to, of course, to having authored the book, The Drugs Don't Work. May I invite Dame Sally Davies to offer her reflections.
Thank you very much, Dr. So. You've given a great commentary as we've gone, so let's just think about what's happening. We have people dying because they don't get the drugs. We have people dying because of an excessive use of drugs. And we risk losing the battles we have won on TB, on malaria, on HIV as resistance goes up, let alone about the bacteria as well. And where are we going? Jim, Lord O'Neill, has shown us how it will be bad if we do not do something. So what can we do? Well, we can do as the global community has been doing. We can make resolutions, feel we've done something, and go back to our countries, and business goes on as ever. It gets worse and more people die. Or we can grasp this opportunity of a global action plan agreed by the WHO, agreed by the FAO, agreed by OIE, and make it happen. And that's why we really need the UN high-level meeting. We need it because, as we've heard and we all know, this is cross-sectoral. It needs lifting up. There are other people involved, not just the member states and those organizations. We heard mention of the environment. We heard from UNICEF, Médecins Sans Frontières. There are all these other players, let alone the private sector, who somehow have to work with academia in the innovation field for both the diagnostics we need and the new drugs we need. So I'd say it's about time for some leadership. It's leadership from you diplomats in the front row. It's leadership from nation states, and it's leadership from everyone. And this UN meeting can be as powerful as we, the players, want. Or it can be what in English we call a damp squib and do nothing. Can we move to stopping growth, promotion, use of antibiotics in animals? Of course we can. But will we? It's a challenge we've got to face. Can we get rid of excess use? Yes. Can we help the logistics in poor countries to improve access? Of course we can. We've got to just get on and start to solve this complex issue bit by bit. Stopping internet sales, stopping antibiotics being put into routine animal feed. And all of this, as Precious put so well, is going to need coordination, transparency, and real thinking so that nobody is left behind. The MDGs have delivered, but let's let AMR be the reason the SDGs aren't delivered. So I hope we don't squander this moment, but it's for all of us to do it. And if you are not expert at this and you want the background, then there is a pile of the books over at the back and you can pick some up. Thank you.
Thank you, Dame Sally Davies. Your passion is clearly infectious, and I would suggest to our audience, actually, the resistance is futile. Now we will hear from the WHO Assistant Director General, Keiji Fukuda, Dr. Keiji Fukuda, who also serves as Special Representative on Antimicrobial Resistance. In shaping the global approach to AMR, he has played conductor over what must sometimes seem to be a cacophony of global interests in this space, but he does so with masterful even-handedness, equanimity, and insight. Dr. Fukuda, may I invite you to offer your thoughts?
Thank you, Anthony. You know, I started my training in medicine at the start of the AIDS epidemic, and in this week in which HIV will be discussed, it's really impossible for me not to draw some parallels in my own mind. When I think back to that time, one of the characteristics, or one of the things I remember most, is that we knew that something was going on, but we really didn't have any inkling about the scope, about what was to come. And I think in many ways, we are further ahead with AMR, but we are a little bit in the same situation. But the thing I remember most is that when I think backwards, the biggest lesson is that so much time was wasted. Just a huge amount of time was wasted, and I think this is what drives many of us now. Now, the reason why the UK review has been so incredibly useful in a lot of ways is that I think that Lord O'Neill and his team got the narrative right, they got the scope right, and they've gone into what are the practical options that we have to deal with. Because the global challenge right now is that how do we retain the eyes on the scope of what has to be done, and at the same time, how do we prioritize? We can't move on everything exactly at the same time, and how are we going to do this effectively? And I think this is why the two meetings which he highlighted coming up are so important, which also Sally highlighted. Both the high-level meeting at the UN General Assembly, which is aimed at the heads of state, and also the G20 meeting, which is really one of the major economic engines for the world. And I think the question is whether leadership will be exerted. And so the question is, what does leadership mean in this kind of situation? And I'll just offer two things that I'm personally looking forward to. One of them is that I think leadership is needed to enable preemptive action to take place. You know, as the O'Neill report points out, we're either going to act now and pay a little, or we're going to react in the future and simply suffer the consequences. I mean, that choice is very stark, and it is in front of us. The second thing is that what is the most effective way, and I'm quoting from your report, to allocate resources and risk? This is the issue which binds and connects together the issue of access, the issue of how do we finance such an endeavor, and also how do we handle some of the challenges coming up with the idea of sustainable research and development, at the same time balancing the access to the products which are developed. And so with that, these are the things that I look forward to being really jumped forward from these two major meetings coming up. So thank you.
Thank you very much. Both of our discussants are emphatic, of course, in the need for collective action, leadership from all quarters and sectors, and of course, they admonish us not to squander this opportunity. The choice, as Keiji puts it, is to pay now or pay more later. Now I want to open now actually the floor, and we will alternate between some brief 2-minute interventions and other questions from the audience. So anyone wishing to pose a question may queue up actually in the standing microphone in the middle of the room. I will begin with actually inviting Ms. Carla Mukavi, Director of the FAO Liaison Office in New York City. Wonderful.
Thank you very much. I really want to start by thanking every woman, every child for associating FAO with this event, and also welcome and recognize the report presented here by Lord O'Neill that we really appreciate. I know that we don't have much time, but what I would like to say is that, of course, we heard from all the panelists that progress towards achieving the Sustainable Development Goals is really threatened by the emerging threat of antimicrobial resistance. So this is really a big challenge. Speaking from the FAO perspective, I would say that intensifying food production and food systems means additional challenges in disease management and even higher potential for increased antimicrobial resistance. So the burden of AMR is mostly affecting those rural poor. This was also mentioned by the panelists, who live in close contact with their animals under poor hygienic conditions. This is something that I wanted to highlight, and also highlight that most of the smallholder farmers are women living in very fragile environments and exposed directly to the most common infectious diseases. And even if medication is available, it may not respond. So I would say that given this complexity, of course, FAO is fully committed to the One Health approach, together with WHO and OIE as a tripartite. FAO with member states and the commercial sector have to ensure health, animal welfare, and the people's livelihood. I would also say that, of course, we have an important role to play in identifying and, of course, defining strategies to reduce AMR threat as the sole international organization, and this was also mentioned here, combining agricultural aspects, food safety, and environmental issue in aquatic and terrestrial settings. And, of course, most of the work that we do was also highlighted here, Codex Alimentarium. We are really expecting that we will come with very important results. So I really trust that today's discussion will really contribute to the successful outcome of the high-level meeting in September. Thank you.
Thank you so much for adding FAO's important voice to this. And if I could take one question from, of course, the standing microphone there. I'll be alternating until we're about 6 deep, at which point I'll ask the panel if they could have some responses directed to some of the first 6 interventions.
Thank you. Laurie Garrett from the Council on Foreign Relations. 2 very quick questions. First, directly to Jaap. Do you have economic data that can help us argue that decreasing the use of growth promoters does not deleteriously affect the economic outcome for the farmer, and that there's savings? Can you demonstrate that yet? And then just generally, we've only heard the Callistin plasmid mentioned, but of course we have NDM 1, 2, 3, 4, 5, 6, 7, 8, and 9, and we have the Visa plasmid, the MRSA plasmid, and a whole host of other plasmids. 30 years ago, WHO had a plasmid monitoring service and a database for monitoring plasmids around the world for drug resistance, but in those days it was really expensive, time-consuming, and difficult to demonstrate the existence of a plasmid in a given sample. Now, with metagenomics, you can do it for pennies, and high school students can do it. Why is there not consideration of linking demonstration of the existence in key environmental samples of key plasmids to direct action? Why don't we go that step? For example, to do metagenomic surveillance of soil, agricultural soil, human sewage runoff, random market sampling of livestock, coastal water sampling. And if you find the presence of plasmids in those samples, you get mandatory upstream action. Shut down, stop use, and cease use until you demonstrate no more presence of plasmid in samples.
Thank you, Ms. Garrett. And I'm going to keep moving so that we actually have opportunity to hear as many of these interventions as possible. I will next actually invite Mr. Lucas Wiarda, Global Marketing Director and Head of Sustainable Antibiotics Program for DSM Sinochem Pharmaceuticals.
Yes, thank you. My name is Lucas Wiarda. I'm representing DSM Sinochem Pharmaceuticals, one of the leading manufacturers of sustainable antibiotics. I'm thankful for the organization of today. I'm thankful for the AMR review with the courageous outcomes they have reported in their report. And I'm thankful for the antibiotics themselves, which saved my life twice. And especially the last sepsis I had 5 years back was very intense, and I'm grateful that I'm here because of the antibiotics. Second, I am grateful that you offer me the opportunity to address a topic which is persistently and continuously not discussed enough in the public debate of AMR, and that is the pharmaceutical pollution. We know that a number of manufacturers, primarily in China and India, let's say around 200, including our own plant, that we generate around 30,000 to 70,000 tons of active antimicrobial waste annually, which needs to be treated. If not treated, the untreated effluent waste is disposed unnecessarily into the environment, making local communities sick and suffer, including women, children, newborns, and many others, whereas it could be solved. Now, DSM Sinochem Pharmaceuticals is calling on the industry to stop manufacturing, buying, selling, and making irresponsibly made antibiotics. And we wish to anchor simple basic requirements like operating dedicated wastewater treatment plants at every single site that is making antibiotics, like, of course, testing your effluent on antibiotic activity, to anchor that in legislation. And we need indeed leadership from the policy makers and regulators to do this. And at the same time, we call the industry to take responsibility and make sure that antibiotics are made sustainably clean. And for this, I am doing my very best to mobilize the industry and establish a quality mark or an industry label. All fantastic proposals you have made, Mr. Lord Jim O'Neill. And I will do my very best to mobilize my peers and competitors and marketers, customers, whoever,
Thank
to
you,
come
Mr.
up with this label. Thank you very much.
Thank you very much for your leadership, and we welcome, of course, your efforts on controlling environmental effluents from these point sources of pollution, which are clearly very important. And if I could take one from the standing microphone.
Thank you very much. I'm Stefan Peterson. I'm Chief of Health in UNICEF. AMR is truly a global phenomenon, but I'd like to reflect on the situation in low-income countries where a lot of UNICEF field activities occur, where lack of access to antibiotics actually kills more children than resistance at this stage. Certainly it coexists with excess irrational use, but my message is that as we tackle excess use, we must preserve access. And the excess use of antibiotics in farm animals in this part of the world should not be paid by, the price should not be paid by poor children in poor countries by denying them access. This requires strong health systems and building strong health systems also in low-income countries. There's a Lancet piece from last year that shows that the antimicrobial resistant rate correlates very well with the out-of-pocket health expenditure, the proportion of total health expenditure that is out of pocket. Now, for us as UNICEF, we're already doing a lot of work to tackle antimicrobial resistance. It's called good breastfeeding, it's called good nutrition, it's called hand washing, it's called water and sanitation in health facilities to prevent infection. And on the rational drug use side, it's called integrated care, IMCI, Integrated Management of Childhood Illness, ICCM, etc. So it's more of the same in stronger health systems. Now, we need to build those health systems. We need health insurance solutions. We also need to stop addressing diseases and start treating patients and children. For instance, tackling malaria vertically and saying, congratulations, your child does not have malaria. We now have good evidence that that actually leads to very high irrational prescription of antibiotics because you want to satisfy the parent and yourself as a health worker. So in addition to strengthening health systems, carrying on the work we're doing, I'd like to call for surveillance, not just of antimicrobial resistance, but also of drug use, of access and use patterns to see whether the interventions we put in place make a difference. Thank you.
Wonderful. Thank you so much. And if Ms. Stephanie Amadeo, the Minister Counselor for the Permanent Mission of the United States to the United Nations is present, we invite your intervention.
Good afternoon. First, I just wanted to thank the hosts and the presenters for the meeting, this briefing and meeting this afternoon, in particular Lord O'Neill and every woman and every child. I think the meeting today shows, with the diversity of speakers, hosts, and participants, is a real testament to the importance and seriousness of this issue and the breadth and depth of commitments to countering the AMR. We very much believe that the United States government very much believes that antimicrobial resistance threatens the health and economic potential of all nations and all people. Every individual, community, and nation holds both responsibility and opportunity for solutions. The WHO Global Action Plan is most definitely a roadmap for a global approach to AMR, and it enables a whole of society and a whole of government action. With regard to AMR and the SDGs, one of the topics of the discussion this afternoon, with certainty, the Sustainable Development Goals and AMR are interdependent and both rely on a broad range of actors beyond health. The emergence and spread of AMR undermines many of the SDGs that go beyond health, including poverty, gender, equality, hunger, and economic growth. In turn, achieving SDG targets will improve opportunities to combat AMR. The GA high-level meeting on AMR offers a unique opportunity to galvanize political and multisectoral support for combating the emergence and spread of AMR. Mobilizing individual communities and national action is essential to ensuring the long-term efficacy of existing and future therapeutics. Ensuring, as we've heard today, diverse UN representation at the meeting and reinforcing this whole of government and whole of society approach with diverse stakeholders is absolutely essential for a successful high-level event. Every woman, every child's active involvement in this meeting today exemplifies the diverse stakeholder ownership that is needed for immediate and long-term success. Since September 2014, the United States government has issued a comprehensive set of federal actions to combat the rise of antibiotic-resistant bacteria and to protect public health. So the United States remains a committed global partner in combating the emergence and spread of antibiotic resistance. Thank you for your time.
Thank you, Ms. Amadeo. If I could, I'll take one more from this. What I'll do is we're alternating actually, and because of the interest of time, we'll only do one round. So what I'm going to do is I'm going to alternate the remaining actually ones that have been lined up, as well as, of course, the ones from the mic. And then I'll ask every one of the panelists to address both the questions that actually have been posed, such as Laurie Garrett's, and then also to make a final minute of reflection, okay? So just to know you're coming next. Yes, from the microphone.
Thank you very much. Bruce Altavote from Pfizer. I'd like to commend Lord O'Neill, the staff, the AMR Review, for a terrific job in making sure that these issues, significant public health issues, are being highlighted, and a great job with the report. Pfizer supports the importance of surveillance, of stewardship, of access to vaccines that have been highlighted in the report. We also support the importance of R&D incentives. Many of these issues, including the surveillance of stewardship, have been highlighted in the Davos Declaration that was released earlier this year and has now been signed by over 100 companies and 11 trade associations. And we look forward to an opportunity to continue to partner with you, Lord O'Neill, and the others in moving this forward. My question is, given the opportunity by the G20, by the UN meeting, it's moving away from an independent panel that was chaired by yourself and into a governmental operation. And where are the venues for companies like Pfizer, for industry, to engage and be part of the dialogue so that we can continue to be partners and stakeholders moving these efforts forward? Thank you.
Thank you very much. And I'd like to invite now an intervention from Ms. Jean Halloran, Director of Food Safety at Consumer Reports.
Thank you. Consumer Reports, for people in the United States at least, is pretty familiar. We have 8 million subscribers and do a lot of car testing. But we also have concerns about health and about food safety, about all the things that you might buy in the marketplace. And we have been deeply concerned about this issue of growing antimicrobial resistance and have had deep frustration over the lack of inaction. It isn't that the problem hasn't been recognized for some time, but there hasn't been action on it. And so in the last few years, we launched some efforts on our own to at least start to get baseline data. We worked to pass laws in 20 states so that hospitals had to report their infection rates. Just something really, really basic. All hospitals should be required to report their infection rates. We also really need data on animal use. What has happened in the Netherlands is very instructive, as well as Denmark. You have to get to the facility level, to the plant level, to the farm level, and tackle the question and set limits. So we're really encouraged by what we've heard today and by this report, and we're really very encouraged by the mobilization that we hope will happen globally in September.
Thank you so much, Ms. Halloran. And one question from the standing microphone.
Thank you very much. My name is Lyndall Rowlands. I'm a journalist with IPS Interpress Service.
My question relates to the agricultural sector and the upcoming high-level meeting, General Assembly meeting. What is holding back government regulation of antibiotic use in the agricultural sector? How will the high-level meeting address this? And is there a role for richer developed countries to be assisting developing countries in that area? Thank you.
Wonderful. Thank you for the question. And a final intervention from Dr. Otto Kars, the founder of REACT, Action on Antibiotic Resistance.
Thank you very much. I try to be very brief. Something has already been said. Having worked with this issue for almost 20 years, I'm quite astonished by the momentum that we have now, not least 2 years. And congratulations to the AMR review that has really put this up high up on the agenda. Now, we have to realize that we're talking about the post-antibiotic era to come. But some countries hasn't even entered the antibiotic era. That has been said before, not least by Stefan Pettersson recently. And we have to increase access, and we have to use the technologies that already is there, like vaccines and existing antibiotics. So the world needs to deal with this from a global development perspective and support the developing countries with this issue. Secondly, antibiotic resistance cannot be eradicated. It cannot merely be managed. We just have to live with it. So far, we have avoided to seriously address the system changes that are needed both in healthcare and in the livestock production. Instead, we covered up for these management problems by relying on the pharmaceutical industry to produce new antibiotics when the old ones doesn't work. But that has not been a sustainable system. We all know that. The current business model has failed, and there are no drugs in the pipeline. The reasons for this are not merely financial. In fact, they are primarily scientific. And that, I think, is really important because it's said that to develop a new antibiotic for a gram-negative bacteria which had entered the bacteria, not be spit out by efflux mechanism, not destroyed, is a nightmare for medical chemists. And the commission paper before the G7 meeting in Germany told us that it might be as few as 250 researchers that really knows, are already experts in antibiotic drug development. So having said that, I think that we need to find ways for global collaboration between academicians and university researchers. I think that is the real bottleneck. They need to collaborate openly and not duplicate mistakes, and do it in collaboration with the pharmaceutical industry. But coming back to the AMR review, I think there might be a sort of imbalance a little bit in where the incentives were placed. I think the Global Innovation Fund is really, really critical, and it's much less money proposed in that sector on the upstream problems than the large rewards on the downstream. So I think we need to think on that and how universities and researchers across countries can collaborate in a much speedier way. And yes, stop, they said. Okay, fine. But technology is not the solution, only solution. We have to have social innovations. And I don't think that an awareness campaign is doing the trick. We need to go much deeper into cultural beliefs and social innovations and social behavior and social norms. Thank you.
Thank you, Dr. Kars. Such an important reflection to end this set of interventions, a very rich set of actually reflections. May I invite now the panel to provide both a weaving in of a final reflection and a response to some of the questions. I would flag that there are at least 3 sets of the interventions that do require response. I think to Jaap Wagenaar in particular, there is a couple of questions from Lori Garrett. The Pfizer, of course, asked a question about the engagement of industry in the process, and the IPS, importantly, also asked about particularly the obstacles to policy advances in the agricultural sector. So if, along the way, if you could do us the favor of answering the questions, I know it's a tough job, but a minute or more per person, if possible, beginning with Precious.
Okay, thank you very much.
Sorry.
Okay. Thank you very much. You're welcome to call me Precious. Just to say that in South Africa, as a general response, we've actually come up with a global plan of action that involves all sectors and all stakeholders. We signed a declaration with commitments as to what is it that every sector and every stakeholder must do So it's probably a way to go. The second, I think, is about just a comment about the environmental factors of the manufacturing of antimicrobial agents. I don't think it's limited to India and China. I think it's a general problem, and it has to do with the regulatory capacity in countries. And perhaps our call for action must be about coming up with innovative regulatory pathways, but in particular, regulatory capacity, because the residues that are found in animal producing products, we have to regulate that. We look at residues, and the regulatory authorities have to monitor that. I don't think it will be, and it is, about just 2 regions. The next one is about health systems. I couldn't agree more. I mean, strengthening health systems and ensuring social protection and addressing quality of healthcare is important. And in conclusion, I would like to say it's about governance, stewardship, but also addressing preventative measures. Preventative measures about vaccines, hygiene, and hand hygiene is not just about washing, it's about access to products for both health professionals and communities to ensure good hygiene practices. Thank you.
So thank you again. Just in closing, I thought maybe by comparing 2 diseases in particular where MSF is quite involved to see the differences. In HIV, the successes of the last 2 decades can be, I think, summarized in 3 points. That you have government action and practical action, that you have accountability from thousands of civil society groups and patients around the world, and you have access to drugs. And if you look at TB, you have the opposite today. We're really just at the starting point. You have no accountability in some respects because there's very little civil society. You have little or no research and development because there is no market in high-income countries as there is with HIV. And you often have no access because the toxic drugs that are available are very expensive, or they're often used irrationally even where they are used. And I think then in thinking forward, we really have to make sure that we are taking this broad approach, but we are taking a new approach and a reformed approach. And I think it's important, for instance, that companies like Pfizer are here today actually to offer their perspectives as a company that actually had exited anti-infective development a few years ago. But I think in order to make this happen, in order to make this sustainable, we're really going to have to reform what we have done in the past so we don't repeat our old mistakes and that we really can take new approaches. Thanks.
Yes, hello, and thank you. I'd like to respond to the comment from the speaker from the FAO, and I agree with that. And that was something that one of the very important things we need to think of in terms of these animal agricultural systems. It's the people that are even living them or living very close to them. And we're expecting a large increase in the antibiotic use as with intensification with agriculture. And when you have intensification, you're going to have intensification of the waste and increased uses in antibiotics. So I think this is an environmental part that we really need to be aware of, as well as effluent from the pharmaceutical plants. Another one of the speakers at the mic mentioned about we need to monitor and take action. And one of the things that several experts asked in a letter to Nature in 2013 is that we consider that certain types of resistant bacteria probably should not be allowed in food. And how can we create a system to actually address this? And in that case, they were talking about carbapenem-resistant bacteria in food. And I think we may want to think about, okay, is colistin-resistant bacteria acceptable in food? We need to really have a conversation and have international standards around that. In Dr. Carr's final statement, he talked about we need more than awareness campaigns. And what we think that we really need to do is think about how can we take some of that funds to actually help empower civil society organizations that can you're driving awareness through actually taking action and pushing for action. Instead of just making people aware, we have to actually try to do things. So.
First, I will come back to the question about the economic effects of banning the growth promoters. I think the growth promoters are now for 10 years banned in the EU, and we are economically doing, I think, quite well. So it is possible to run an animal health production without growth promoters. The second thing is that the reflection. is that in the Netherlands we absolutely believe in the One Health approach without blaming each other. This half year the Netherlands is the president of the EU, and our ministers for agriculture and health has organized a high-level meeting for all the European ministers of agriculture and health, that at least they could meet and could speak about this problem. So we absolutely believe in the One Health approach. And my final remark, and that's not mentioned very often today, is that I think we have to give special attention to what is happening at the veterinary side in the developing countries. There is what we expect, a lot of intensification of animal production, but realizing that there are many countries where there are hardly professionals to give advice about treatment of animals. I think that's an area where really we have to pay attention to, because otherwise we are in a Western and luxurious world. We have settled problems, we think, but I think there is a huge need also in developing countries at the veterinary side to help these countries to solve problems.
Oh. I haven't any particular things to respond.
Thank you. So I want to pick up on data, because I agree with Laurie. We need data. What's happening on the ground, and it needs collecting together in two ways: as surveillance and actually for individual users to know. So we need to know what resistance is going on. Is it a plasmid? What are the residues in the milk, the food? The civil society then can play an accountability role because of labelling and knowing, and governments can start to think about what is their role in regulations if they have the data. We're going to need to know consumption data, which gets you into access and excess, and ways of getting better at that, which are not just sales, though that's a good start. But we're getting, in the UK now, data right down to individual doctors, and we can then work with doctors who consume or use more. So I would say we need surveillance, and we need transparency, and we need accountability to civil society and governments. And I'd finish with saying, but don't let's make making a system perfect the enemy of moving forward steadily and improving steadily. Because if we wait till we have a perfect governance system, we'll still be talking in a decade, or at least the young ones will.
Thanks, Sally. Let me try to address two questions and give you a final thought. Again, to go back to Laurie's question about surveillance, I think surveillance is clearly not where it should be right now. But I also think that monitoring for plasmids and responding to them is not the way to go. I think basically what we have to focus on is how do we reduce the root causes of resistance developing, and that's where we ought to put our efforts. The second point is the question which came up from the gentleman from Pfizer. The private sector is absolutely critical to finding solutions to this. I don't see going to the G20 and going to the high level as closing down those avenues. In essence, all of the tough issues are going to require a public-private partnership. I think that there will be additional processes to try to get at some of these things. For example, the process to address the options for stewardship and development framework. This is where a lot of the venue discussions will come up. But the last point I want to make is that, we have some questions that we don't know how to answer right now. We don't know, for example, how do we transition over large economies which use antibiotics in the agriculture sector, and can we use the available experience? There are things like that which we don't quite know how to do, and we're going to have to figure that out. But in reality, many of the things that we need to do, we know. If you look at the Global Action Plan, if you look at the O'Neill report, again, what needs to be done is pretty clear. What we're struggling with is how do we do that in a way which is sustainable? How do we do it in a way that is at scale? But this comes back to Sally's point. While we struggle with those larger issues, We have to move ahead. There are many things which can be done. When I look in the room, we have opinion makers here, we have the people who support decisions, we have the people who report these things in the literature and so on. A lot of the people who drive how the world thinks and what the world will do are in this room, and many of the things which need to be done can be started today. We don't have to wait for all of the answers to be available. Thank you.
I'm going to, I'm going to risk this young lady waving a red stop sign. Six very quick things. Six very quick things in summary. When we published our final report, it was the first, compared to the others, where we didn't write an op-ed straight away, but I'm going to write another one. We planned a couple of weeks afterwards on reflecting what we heard. And I could imagine it being entitled Appropriate Access and Not Inappropriate Excess. To reflect on much of what I've heard. Second thing is on the latter comment here about the number of researchers. And you're right in some ways, and you're also right that I didn't highlight everything we had in our report. The Global Innovation Fund is geared towards getting a lot more than 250 people for the future. We have a table specifically that shows how striking how few people work in this space. And that is a pretty easily solvable thing. Third thing, on ag. We've recommended a phased 10-year target around the world, starting in 2018. I hope that will be in the UN agreement, or something close to it. Number 4, on the Pfizer question. I risk being blunter than, well, no, I'm always blunt. I'd call it enlightened self-interest, not just self-interest. There are plenty of ways that the company sector can still engage, and engage in a way to help policymakers do things that are right for everybody. And linked to the final thing I would say, one other before it, everybody has got to get out of their comfort zone. I joked with Sally and the Prime Minister when I was first asked to do this, and I think this lady here reflected on it. Everybody's known about a lot of these things forever. There's not much point, our review, coming into existence if nobody's going to get out of the comfort zone, and that applies to companies, policymakers, the agricultural sector, and everybody. Fifthly, in my professional life, South Korea is possibly the single most interesting country in the world, because it's the only one of more than 45 million people that has gone from low-income status to developed country wealth. The fact, I did not know that there was going to be somebody from South Korea today talking about how they're dealing with it. There is yet another example for many large countries in the emerging world of looking in, as in other aspects of life, of how you can become a wealthy country and not fear that this is going to be something that stops your development. And it's wonderful to hear that. And then finally, linked to that, get out of your comfort zones to make sure we have a proper UN agreement and solve this problem. Now we have a chance. Thank you.
Thank you. So there you have it, a wonderful set of informed perspectives, not only on the panel, but also from you, the audience. Tackling antimicrobial resistance will take more than just drugs. We'll need diagnostics and vaccines as well. More than focusing incentives on one company, one drug at a time, we need financing that will transform how we innovate, de-link return on investment from volume-based revenues, offer a portfolio of promising products, and rethink how we deliver these health technologies to those in need. More than just the efforts of the health ministry, we'll need whole-of-government commitment. More than just the efforts of healthcare providers and patients, we'll need our agricultural sector to do its part in curbing non-therapeutic use of antimicrobials, a One Health approach. And more than just those of us who have worked tirelessly on this issue for years, we'll need all of you. Later this week, as alluded to both Keiji and Rohit, many will gather here for the 2016 high-level meeting on ending AIDS. Some of us can recall firsthand where we were in the late 1990s when the diagnosis of AIDS was all but a death sentence for the 25 million so afflicted in the developing world. From Kailicha to Geneva, the global health community was galvanized into action by patients, providers, and civil society. Nearly 2 decades later, generic competition enabled by the TRIPS flexibilities, a global fund, a medicines patent pool, a range of product development partnerships, and a host of innovative financing mechanisms have followed. These experiences position the global health community quite differently today. And just as AIDS mobilized us a generation ago to rethink how we deliver treatment to those in need, the challenge of antibiotic resistance might do the same today. This is a global challenge that we all face together. We hope that we can count on your commitment. Well, one cannot help but actually be impressed by the commitment of those on this panel and working on AMR. Please join me in thanking our distinguished presenters for sharing their insights on the road forward. And now I would like to invite Nana Guo to facilitate the final part of today's briefing and our concluding remarks.
Thank you, Professor So. So next, I'd like to invite His Excellency, Minister Gabriel Wikström, Minister of Public Health, Healthcare and Sports of Sweden, to share his reactions to what we've heard today. Sweden has held a prominent role globally concerning antibiotic resistance, and Sweden has been a driving force in the development of a global surveillance program through a dedicated platform for digital information. So, Minister, what is your vision for what we can accomplish for the United Nations in the coming months and years? Please.
Well, thank you, and thank you everybody for a very informative and interesting afternoon. Ladies and gentlemen, it was only 2 years ago that the World Health Assembly asked the WHO to prepare a global action plan on AMR. Only 1 year ago that 194 member states adopted it, and the Alliance of Champions Against AMR was launched. So from a breakfast meeting of a few ministers in Geneva a year ago to all of us here in the Grand Ballroom at the Yale Club. And in a few months, that high-level meeting on AMR at the UN General Assembly in September. Momentum, yes. But momentum, all of us here must really go on driving and ramp up. To quote Winston Churchill's, "This is just the beginning of the beginning," is often a cliché. But it could not be more true for where we are now in the war against AMR. A war we must too win. So we need to really push forwards towards, at and beyond that UN meeting in September. Us here, we who know, must keep on informing, publicizing, and speaking out with our colleagues, associates, and counterparts in and across all sectors and all borders, until we have no hiding place for AMR or for governments and politicians. And for those who say the multisectoral nature of fighting AMR or the SDGs of Agenda 2030 are all too complex, I would say this. We already have enough demagogues around the world today with their simplistic prescriptions and hatred of complexity, diversity, and change. Life isn't simple. It never was. And our advanced, interdependent, and globalized 21st century isn't simple. Human progress isn't simple. But it can, as AMR shows, be reversed. So, ladies and gentlemen, in this drive and in our determination to fight back AMR, we not only can ensure that our children and our children's children will not be condemned by us and indifference and inaction, to a turning back of the medical clocks to the dark old days before us. We can also show them and us what we really can do in, with, and for our diverse, connected, and wonderful world. We can show our children that progress means progress and can be sustained, that antibiotics were a start, not a dead end, and that they and we are all about the best in human nature, not the worst. So in what we can do and must do, I wish them all and us all that's very best. Thank you very much.
Thank you, Your Excellency, Minister Wikström. Thank you for inspiring words to end our discussion today. Now I'd like to invite His Excellency Ambassador Mateo Estreme, the Deputy Permanent Representative of Argentina to the United Nations, to offer the closing remarks on behalf of all of our co-sponsoring member states today.
Thank you very much, Ms. Kuo. And I would like to thank all the organizers for this very enlightening event. I am not an expert on AMR. I am a diplomat. But I see these kind of events as key to forge a partnership between you, the experts on these issues, that could give us a real understanding of the dimension of the AMR challenge that we are going to face as humanity. And us, diplomats, that will have to carry on with the negotiations on this very important issue at the General Assembly and elsewhere. So I believe this event has been fruitful in forging that partnership, and I hope we can continue engaging in this kind of dialogues. As very well expressed by Lord O'Neill's findings, and for what we have been discussing and working on this issue, and what has been discussed today, and what has been discussed in Geneva, the issue of MRR is definitely one of the greatest challenges that the international community will face in the upcoming years. It is a cross-cutting and multidimensional challenge that will require a swift, sustained, and coordinated response by states, international organizations, the private sector, the civil society, in brief, the international community as a whole. Its consequences will severely affect, in the midterm, not only public health, but also development, economic activities, the availability and quality of medicines, food, and other basic resources. The cost of inaction in front of us is in front of this rising challenge will be simply too high to ignore. As we managed to achieve the historic commitments of last year's regarding, for example, sustainable development and climate change, it is now imperative that we now join efforts to gather political and needed resources to collectively address the issue of AMR. And in that regard, as it was mentioned today, we must ensure that when we try to achieve the common objective of getting to the results that we envisioned when we adopted the Agenda 2030, we make sure that the agenda is achieved and that MRR is not going to be an obstacle in achieving the SDGs. So we have to act swiftly and quickly in that regard. We are convinced that this issue should be at the forefront of the United Nations agenda, and I believe that all the countries represented here share this common belief. And we believe that this clear challenge does not and will not recognize borders or any sort of differentiation. As such, and given the complexity and multidimensional nature of this phenomenon, it will be necessary to devise collective and multisectoral responses to address it galvanizing the political will and leadership of all relevant actors. At the same time, I believe it has already been highlighted today, we need tailor-made approaches, even if we are going to aim at devising a global template to address this issue. And tailor-made approaches are needed because what might work for developed countries maybe cannot work for developing ones. And in that regard, I believe that has already been mentioned, access to medicines should not be one of the side effects in these negotiations, especially for LDCs and other vulnerable countries. So we have to ensure that when we negotiate this, we take into account the needs of all countries that are facing this challenge. To conclude, we firmly believe that the moment has come for the international community to tackle this issue through the World Health Organization, of course, but the United Nations is a venue to consider this issue. We are convinced about this. We have to devise a common, coordinated, and sustainable solution, and in that sense, we commit our active participation in the process. We sincerely hope that this moment be the kick-off of the process of collectively addressing this issue, one of the most recent and serious challenges faced by humanity. We are convinced that the time for action is now. So with that, I wouldn't be on the way between you and the reception for much longer. I would like to thank you again for this very enlightening dialogue, and I would like to thank all the panelists and the other co-sponsors for this opportunity. And I believe that the process that is going to be open at the General Assembly at the United Nations is going to be a very interesting one. And I hope that this partnership that we are forging today could endure through all these negotiations that we are going to undertake. Thank you very much again and congratulations to the organizers. Thank you.
Thank you, Ambassador Estreme, and thank you for your commitment for action, ambitious action, particularly in the upcoming negotiations and discussions that will start commencing next week now, led by the Ambassador of Mexico. So, based on what we have heard this afternoon, and what is needed at national level is to develop or review and effectively implement national action plans, improve and implement guidelines regarding appropriate use of existing antimicrobials, and see that more countries take this issue up as a priority. At the global level, we are striving for an increased public and political awareness of this neglected area, and expanded financing for research and development. Finally, we must ask ourselves, what is the potential for intergovernmental action on this issue? And we hope that, as we heard today, from all of you in the room, as well as from the panel, we do hope for a multi-sectoral, multi-stakeholder, and ambitious commitment to action coming out of the high-level meeting in September. We have heard today both the global and national responses to this issue should span across the health, animal, agriculture, and security sectors, and research and development agendas. So we have a lot ahead of us, but I think also coming out of this discussion, most of the responses has been of positive commitment to take this forward, and particularly to get an ambitious outcome by the end of this year. And as I said at the beginning, this is a very important year for action for AMR. And I think we should seize a lot of the political leadership that we have seen, particularly from many of the member states who have co-sponsored this event, but also from the leadership of Lord Jim O'Neill and the Minister of Sweden here, that we can actually achieve a very, very ambitious outcome in September. So on behalf of Every Woman, Every Child and the other organizers, the REACT Network and the Dag Hammarskjold Foundation and the other co-sponsoring missions to the United Nations, let me extend our sincere thanks to all of you, all of the participants and speakers today, including those of you who have joined us on social media. And this concludes our briefing today. And I'd like to quickly hand over to His Excellency Ambassador Peter Wilson, the Deputy Permanent Representative of the United Kingdom to the United Nations, who will be hosting the reception following this event until 5. Thank you, Peter.
I am the last person who stands between you and a drink, so I am going to be very, very short indeed. I have one story to tell you. I grew up in the street where Alexander Fleming lived. And my second son was born in the hospital where he worked, St. Mary's in Paddington. He died a long time ago, and the house is pretty old. He knew that this was going to be an issue. So the issue before us today is not how long have we known about this. Intelligent people have known about this as a possibility for a very long time. The issue before us today is what we are going to do about it. So I'm very grateful to Nana for focusing on that as the point at which you come to have a drink, because there's no such thing as a free drink in the UN. We want you to do some work, and we want to do some work ourselves. I do want to thank the organisers. I do want to thank REACT, Every Woman, Every Child, and the Dag Hammarskjold Foundation. And I also want to thank the wide variety of co-sponsors, Matteo from Argentina, Vietnam, the Netherlands, many others. I'm not going to run through them all now. But the point about this is, and the reason why there are so many people on this board, is there is a groundswell of opinion in the UN. As Matteo was saying, there is a groundswell of opinion in the UN that it is time that we harnessed international action to do something about this. So that's what your drink's for, and I hope we talk about it some more informally. Thank you very much, everybody.